Hello, everyone. This is Dr. Khan, so I'm going to go ahead and get started. Um,
Hi, how are you?
Hi, hello.
Hi, how are you?
I'm doing good. Good to see you.
Good to see you
Pleasure to have
too.
you on. Okay, so let me go ahead and set this up. Please bear with me as I try to put this. Okay, all right. Um, Carla and Avi, are we good?
Yeah, we're
Okay.
good.
Yes, we
All
are.
right. So, Dr. Ranganathan, I have Carla. She's part of my IT team and also AV. And so basically, we're going to go ahead and make sure that our guests are going to be able to join. Now, we are going to be recording this, and so we will have this available for you so that you can go ahead and take this and share it with your many other members on the Instagram and other social media posts.
Awesome. That sounds great.
All right. Okay. All right. So whenever we're ready, I'm going to go ahead and get started. I'm going to go ahead and invite my guests on. So please bear with me. They will join. They know we are recording it, and I have it on my Facebook. Okay. All right. Here we go. I'm going to go ahead and invite the guests. Avi or Carla, do we have to let our guests in or they're listening?
They're already listening in, Dr. Khan. I see
Okay.
six attendees now.
All right. So having said this, I'm going to go ahead and get started. Thank you very much. It's a pleasure to basically invite my guest, and it's a privilege to have you on. I have to say, it is always good to talk to a plastic surgery colleague. It is a lot of extensive training. And if you could please, you have a lot of accomplishments. And if you could just please introduce yourself and please let us know about your medical training and plastic surgery training as well.
Well, thank you so much for the opportunity to be here with you. I completely agree. It's so nice to talk to a colleague, and really appreciate you bringing me on your show. I am Dr. Kavita Ranganathan. I'm a plastic surgeon at Harvard. I did my college and medical school at Northwestern University in Chicago. I'm a Midwest girl through and through. And now I live on the East Coast. I did my residency at the University of Michigan in plastic surgery, and then I did craniofacial training at Johns Hopkins. And now I'm at Harvard at Brigham and Women's Hospital, Mass General Brigham, where I practice plastic surgery.
No, that is quite an accomplishment. That's a lot of work, as far as, the years of training and plus the dedicated hours, day and night in the surgical field. And then obviously starting all the way from undergrad, that is a very, very impressive CV. And so if you can please, just so that, there are a lot of other students who are going to be listening to you, if you could just tell us how many years you spend in each, just so that we can appreciate all the time and effort that you have put together.
Well, as you know well, it is years and years and years of training. So I did a combined college and medical school program. So it was 3 years of college for me after high school, then 4 years of medical school. And then I did 8 years of residency because I took 2 years in the research lab, 1 year of fellowship. And that's what brought me here. And I've been in practice for about 6 years now.
Sure, no, absolutely. And that is a lot of hours, and you're looking at, I will say, at least 100 hours a week. And this is a lot of dedicated time when you worked hard all day. You came home only to study, only to do it again the next day, with only a few days off per month and a few weeks off, couple of weeks off every year. Now, for myself, for the many listeners, I myself did my undergrad in biochemistry. And that was I would say I'm almost 8 months away from a chemical engineering degree. And then I did my medical school. In medical school, I took a year off to spend time in Boston. So I was at the Longwood Medical Center at Beth Israel Deaconess. And that's where I got a chance to see and work basically with one of the best researchers. Then I ended up getting accepted into the Yale Categorical Surgical Program. So I was there for a total of 4 years. I spent 2 years doing my burn fellowship, and then I finished my general surgery training at Case Western Reserve University under Dr. Ponsky. And then I did 3 years of plastic surgery training. And so this is a total of 10 years after medical school. And again, this is a lot of dedicated work and effort. And I will tell you, even to this day, Dr. R and myself, we're still learning every day from our colleagues, from the meetings. And so it is a continued process. Medicine 10 years from now is going to be certainly very different than what it is now. Now, what caught my attention was, I was normally I'm not a social media person, but this one post somehow made it to my page. And, it was a very direct and a very honest and sincere message that you had in regards to the breast implants. And there you had mentioned that there are a lot of young patients, young ladies who are getting implants, and they're basically not aware as to what the implications are, the long-term implications. And I said to myself, there is no other better person than you to kind of explain as to what that post was about. What was the message that you were trying to send the young patients and even the many other patients in their middle age years?
Well, I agree with you. I am also not traditionally a social media person, but in the past year, over the past few months, to be honest with you, I was motivated to post on social media because I think that there's this whole space that I had honestly not invested in and also potentially protected myself from. And over time, I've kind of realized that there are a lot of opportunities that come from social media from the standpoint of being able to educate a broader population. And so my motivation for posting on social media was to really address the challenges in figuring out what is actually right and wrong when we think about beauty standards, when we think about the different influences that are affecting our lives. And I talk about that particularly from the standpoint of the mental health of young people in this country. There is an epidemic of loneliness, and I think a lot of that comes from what people are exposed to. And even when you think about beauty standards for young women and men, to be honest with you, I don't think any gender is isolated from this. I think we're all exposed. I think that there is a huge component of vulnerability that comes from, being on all of these platforms and kind of living in this new age that we're in. And so my motivation was really to bring a different perspective to the table. I think a lot of times people are sponsored by a variety of different brands and things like that, and that's wonderful for them. But I think that makes it hard for people to really know who to trust. And that's how, misinformation spreads when you really don't know what to trust. And so that was my motivation for getting on social media in the first place, and probably where the motivation for that post came from.
Right. No, I will tell you, you use a very strong word, which is trust. You have to trust your plastic surgeon. You have to trust your doctor, whoever it may be, who's giving you advice. And you, as a patient, you're looking up to your doctor because whatever he or she says means and basically comes out of utmost absolute sincerity. Now, this is where, the oath that you and I took, do no harm, and we basically want to do unto others what we would want done to ourselves. Right now, basically, you're trying to spread the message where you really need to know what you're signing up for. Now, from your experience and expertise, and given your training, what would you tell that young lady or the other patient, for example, who's interested in getting, for example, breast implants for cosmetic reasons? Like, what is the message that you have for her?
My first message is that your face and your body are not trends. That is so important for you to know because your face and your body are there with you permanently, and you can't or you shouldn't necessarily change that based on what is trending on any platform that you're looking at. The reason why I say that is because I think that there are so many aspects of what we see that we really need to dig deep into before we start changing ourselves. For example, when you look at what women are exposed to, young girls are exposed to, it's about what brands are good for skincare, what plastic surgeon you should see, the before and afters, the filters, all of that does infiltrate into your brain in a way that you're not really able to see clearly, because we're not able to distinguish what's real or not. When you think about men, we think about the manosphere and we think about clavicular and, bone crushing and all of those different things that men are seeing. And so I think that it's really important to know that our faces and bodies are not a trend. I have a 7-year-old daughter, and so I think a lot about body image and what I can do to make sure that she has a healthy body image. And I'll tell you this, no one knows what they're doing in parenting, and I certainly don't claim to know what to do in parenting. I think I know more about what to do in the operating room than I do about what to do for my daughter as a parent. But I will tell you that what I emphasize to her is that your body is a functioning physical thing that is there to help you do what you need to do. Your muscles are there for you to be strong. You eat so that you can fuel your brain. And I think that reframing our bodies in the form of function rather than solely based on appearance, I think that's something that is really important for all generations to know.
That is a very strong message. Do not give in into the trends. Do not let the trends dictate who you are. And one of the ways to kind of put a different spin to this is in real life. As the newer generation is coming about, these are young 17-year-old girls who are getting Botox, for example, or getting fillers, and they have no idea what they're signing up for. And they're seeing an Instagram reel, and the next thing you know, they're signing up with another surgeon, and they have no idea as to what that means. And, I say this to in a very nice, polite way. Someone told me this long, long time ago when I was a teenager, and I still remember it, and it is so true. The key to failure is to please others, and this is where you do not want to please anyone but yourself, in a sense, in a very nice, polite way, because you will never make everyone happy. And this is where, as I get older, I realize, thank God that I can see, I can hear. Look, you take care of a lot of kids with craniofacial abnormalities. You see that we're blessed with so much that we have and do no harm, in a sense that you do not harm your body by doing something that you truly do not know what you're signing up for. Now, this is where I'm a big fan of DNT, which means do not touch. Sometimes when you touch, you only cause problems. Now, a big part of my practice, if not all of it, is revolved around breast implants. And for me, I was going through all these years of training, almost 100, 120 hours a week for the 10 solid years. And remember, going into medical school, during medical school, then in itself was very intense. I said to myself, I'm not going to do a procedure where I myself do not believe in it, number one, which is enhancement using augmentation breast implants. Number two, that where almost always the patients have said two things, which is they wish they had never gotten breast implants. And number two, they wish they had removed them sooner. And remember, there are a lot of patients that I've managed who have had ruptured implants. They have sign symptoms of breast implant illness toxicity, silicone toxicity, and then capsular contractures, amongst other problems that have only ultimately resulted with breast implants. And so for myself, I said, I'm going to do exactly what you're doing, help physiologically in whatever capacity I can. I learned a lot in the burns world, and I also learned a lot in hand reconstruction, skin cancer, amongst the many other aspects of what is plastic surgery. Now, what is your message, Doc, in regards to someone young who's interested in getting a BBL, for example, which is a Brazilian butt lift?
That's a great question. I have a couple different answers to that. So, first for my young patients, I do think that honesty is really important, and I do think bodily autonomy is also extremely important. So those are the two things that I value in my interaction with young patients, and I think there are some patients that would benefit from surgery and other patients that would not benefit from surgery. And so I think approaching the conversation with those two things in mind, really honoring that doctor-patient relationship and the honesty that comes with that, and also recognizing that we should have a level of autonomy in our bodies. Those are the principles that I balance. Now, I will openly say I don't consider myself a breast surgeon. I do operate more on the head and neck area, and I operate from, the day a baby's born until the last day of their lives, potentially. So I think of that as a huge honor. But with that, even if I were a cosmetic surgeon in any environment, I personally would never do or get a BBL. And that is the operation that has the highest mortality rate in plastic surgery. 1 out of 3,000 patients can die after that operation. And there's been a lot of literature on that. So for a BBL specifically, whether young patient, old patient, I would caution you to be cautious. That is my number one advice for that. But in general, with any patient, I think honesty and bodily autonomy, those are the two things I value.
Right. No, absolutely. Now, my take on a BBL is if you ask me, I would outlaw it, ban it today, right now, if I could. It is, if you ask me, it is wrong from every perspective. From a moral perspective, you're making a mockery out of the human body. You see every once in a while patients from Florida, New York, and all over, patients who have gone down to Mexico, for example, gotten these cheap BBLs, and the next thing you know, they're getting fat emboli and death and problems after problem, and they're only replete. And I say this too, and as a physician, I'm entitled to my opinion, and certainly I will say I would have a very straightforward opinion: do no harm, do not touch, do not you do not understand the implications behind young patients, young and healthy, who had full lives ahead of them, unfortunately dying from this, what is, I would say, a wrong operation, a bad operation. Outcomes are not worth it, and you're essentially making a mockery out of the human body. And I will say this as much: I trust no doctor who does a BBL, because why would you trust? I trust someone who's going to go out of their way to doing something that's going to ultimately harm the body, right? There is nothing good about it. And for that reason, I myself take it the notch up. I would not have faith in anyone who would be doing a BBL, because whatever he or she is saying basically would not be able to be validated, because why would you want to potentially harm someone just because a young patient who has the money to pay for an operation wants to get it done? The surgeon should step up as a physician, as a clinician, out of basically that leadership role, should step up and say, you know what, I'm not going to do an operation that's only ultimately going to go do no harm, and we want nothing that is going to come even closer to potentially harming the human body in the name of aesthetics. So
This is
again,
such
going
an interesting discussion because, the question of whether or not something should be banned is a really important one because we are in a time where there is the potential for things to be banned. But I'll tell you an interesting aside to that is that the American Society of Plastic Surgeons, which is the largest organization, the largest group of organized plastic surgeons in the country, came up with recommendations on what it takes to do BBL safely. Now, they put together a task force, they did a lot of research, they did so much homework and came up with, a variety of recommendations on what a surgeon can do to optimize outcomes, minimize complications after BBLs. Despite the fact that this BBL operation is the operation that is associated with the highest mortality rate, they never banned it. And yet, when you look at their statement on gender affirming care, even for adults 18 years or older, they have somehow created a de facto ban with their position statement recently that they released. And so it's an interesting, situation where an organization that should be representing patients makes a stance on one and not the other. And you have to think about kind of what are the ethics of what we're doing? Are we really standing by, what's best for patients using science and data, and how do those things compare? We haven't banned the operation with the highest mortality rate known in plastic surgery, and yet we're making recommendations on other procedures based on one's gender. So it's an interesting discussion for sure from an ethical standpoint too.
right, right. And then again, see, it goes down to doing, look, plastic surgery has what one of my mentors told me, 3,000 operations, right? And I'll tell you, there is a shortage of plastic surgeons. There's a lot of hand, face, whatnot else, not only in the United States, but elsewhere all over the world, right? And so there is so much good that we can do. Look, how much did you study day and night? Are you trying to tell me that after all this education, will go in and do a BBL just so I can get a nice whatever paycheck? It does not suit me. And that is the whole point. And for someone to say, well, they want it and I'm going to offer them a service, which is what my friend, he's a good friend of mine, said, we have to step up as leaders, as professionals, and say, you know what? good thinking there, but it's not good for you. It is not worth it. And ultimately, the result is going to be bad between the fat necrosis, fat emboli, and the infection rate, the risks for death, among others. It's not worth the risk. And this is where we have to step up and say, as plastic surgeons, as MDs, as leaders, each one of us is a leader. Dr. Ari, there's only a handful of you in the world, and that is how much talent you are, how much talent you have. You cannot go about and doing something that is going to be elective and ultimately going to harm because you can do it. Just do no harm. And that is the essence and gist of what is anything professional and what you would want to do unto others. Now, another thing that I must mention here is if you look at the breast implants themselves, they were banned from 1992 to 2007. And what is interesting is they were reintroduced into the market as safe under studies. And now we're starting to see the reemergence of what is the silicone toxicity. A lot of patients coming forth. Look how many Facebook, Instagram members, patients are there looking for answers, and they're looking for relief, and there is no one out there to kind of tell them, guess what, if you have complications, problems, there is relief out there. You have to do the complete workup, making sure you don't have any underlying autoimmune problems. But regardless of that, we have to let the patients know that, if you are hurting, you have signs, symptoms of silicone toxicity, capsular contracture, other problems like a rupture, you absolutely need to get that removed. Now, there's a lot of, I use the word ignorance out there, and a lot of misinformation out there. Misinformation in the sense that many patients that I've managed have said that their surgeon said that the breast implants are lifetime devices. And absolutely, that is the first thing where the FDA mentioned they are not lifetime devices. They do not last in the body. And the longer the patients have them, the higher the chances are that they're going to have problems. And this is where the patients need to understand that if you have a ruptured implant, it is not healthy or normal to keep that in. And you certainly need to get that removed as soon as possible, because we do not want that silicone to basically go and spread to the rest or other parts of the body. Now, Doc, I have another question for you. If someone is interested in getting a procedure, and you're telling them about informed consent, what is it that they should do? Because I will tell you, when I looked at your post, I said, you know what, I'm going to call you. And you have that humbleness. You talked to me, you were very open, you were able, I could tell right away that you want to spread good, you mean good. You're coming forth here and discussing your experience and your expertise in regards to this. A young patient is basically interested in plastic surgery. What is it that you will tell her or him? There's a lot of emergence of male plastic surgery over the last couple of decades, and that has skyrocketed, and obviously, gender reassignment amongst the others. If a young person is interested in plastic surgery or an intervention, what would you tell him or her?
I'll give you an example. So I saw a patient in my clinic, an 18-year-old male that wanted a rhinoplasty. He said that he was getting bullied in school and he hated his nose and he really, really wanted to have a rhinoplasty. And his dad was with him, and his mom didn't come to the visit because she didn't want him to get plastic surgery, understandably. And I think that this is a very common situation where there is a slight disconnect between, what people may want and what is the right answer. And what I'll tell you is that I don't make a conclusion for that patient during my first visit. And so my approach with younger patients is that I will see them not just once, but at least a couple, if not, more times, to make sure that we are doing the right thing for that patient. For me personally, I think it is important that that patient has a good support system around the time of surgery, because if that disconnect is there, then that tells me that I need to do a little more homework before I operate on that patient to make sure that they're prepared and to make sure that they get the result that all of us are hoping for, right? I don't go home and sleep at night unless my patients are happy and doing well. And so similarly for my patients, if they don't get a good outcome, that is, life-changing in the worst way possible. And so my approach to a younger patient, or any patient, to be honest with you, that I really need to make sure that we're on the same page, is to spend extra time with them. focus on the pros and cons, and I'm really honest about complications. Just like you were saying, I do talk about the fact that surgery can actually make things worse. I also tend to undersell what I do, just because I want to make sure that that patient trusts me completely and that I give them a realistic picture of what the recovery is like. Because what you see online with filters and transformations, that is extremely misleading. And so, because I'm not in control of what patients are seeing before they come into my office, I spend extra time during that visit to make sure that they're really well educated about the process. For that patient that I gave you the example for, he's going to think about it. I've seen him twice already. He's going to go, enjoy college for a little bit and think about it. And I think that that relationship is so important because ultimately, if he comes back and says, yes, I really want this operation, then I can feel like, okay, I can get you a good result. And I also know what your expectations are. And I think that's what translates to success long term.
I have to say, you touched on a very important point and a very important topic, which is social support. This is huge. And in my practice, I see patients from all walks of life, literally from every state of the US. I've operated on a patient. And I'm blessed to have a very unique and a population of patients that have complete faith in whatever I have to say. And it's a huge responsibility that I have. And I like you gave an example of this nice 18-year-old. Technically, he's an adult, but officially, he will be always his mama's boy. And the point here is you have to seek help with the older, wiser group, meaning the parents or whoever it may be a best friend or an uncle or a neighbor. No, I have taken care of a lot of patients who got implants because their significant other paid for it. They said they never liked it. Another patient that I saw basically said, I asked her, you knew about a ruptured implant for a long time. How come you're coming to me right now? You had an MRI from 2021. And she said, well, my husband passed away. Now I can make my own decision. Now, these are real life situations, right? Or there was another patient who got breast cancer. And now the next thing 2 months later, her husband said, okay, I don't want to have to deal and see you with chemo and radiation and all that. And he just took off. And these are patients who basically have had to deal with. There are patients that I know, they said they always wanted an explant the day they got the augmentation, and they chose not to because their significant other would feel uncomfortable or will not like it. And so for their own good, for their um, quote pleasure, or for their desire, they chose to get implants. And another patient, believe it or not, my own nurse, she has seen me remove hundreds of ruptured implants, capsular contracture, patients' complaints, right? And she herself, long time ago, not my current nurse, long time ago, went and sought implants, and she knew very well what are the long-term implications, but it was the society's pressure that basically motivated her and convinced her that was the right thing to do. And so this goes back to the point that I was saying in a very nice, genuine, honest, sincere way. Your body, do not harm it, especially when you know what the long-term implications are, and it's not worth the risk. My goal of life, Dr. Ranganathan, is the same as yours, and so is Carla's and Avi and everyone else who's listening, to live to 120 without a trip to the doctor, right? And I want to look the best I can. I want to certainly dress up the best I can. I want to look the best I can, right? I did not have a haircut till this past Sunday, and I got one because I want to look. But you know what? I'm not going to get a rhinoplasty. And now this is just me. Now, if my best friend wants to get a facelift, I'll say absolutely go for it. But I have 100 plastic surgery colleagues, friends. They will tell me just get on a plane, come, and they'll do my platysmal banding, which I think I could qualify for, or my facelift in a few years. But I choose not to because you know what? I like the gray hair and I like the wrinkles on my face, and it makes me age with grace and do no harm. And this is the principle. The whole goal here is do no harm, and I have extended it to my other aspects of the practice. And I'll just use one other example because what you said, the societal pressure is huge, especially in the world of Instagram, like you mentioned. When you go online and you see another young patient talking about her successes with her plastic surgery or her BBL or her whatever, and now that's motivating the next patient to do the same, you have to be very careful because sometimes what you see on social media is not reality. Sometimes you're signing up for complications amongst complications. Now, there was a patient, as plastic surgeons, we do a lot of hand surgery. And if you ask me, hand surgery is certainly very involved, microsurgical reconstruction, finger implants, things like that. So this one patient came to me as a pharmacist. He came to my clinic and he said, "Hey doc, I've got a ganglion on my wrist." And I looked at him and I said, "Can you move your wrist? Does it bother you?" And he said, "It's just unsightly." I said, DNT. That's my term that I use in the clinic a lot. And they always ask, "What is DNT?" It means do not touch. And he said, "Are you serious?" And lo and behold, he listened to me. He's a young pharmacist in his 30s. 2 months later, I was at the hospital. He came running to me and he said, "Doc, it's gone. It's gone." And I said, "What happened?" He said he hit it on the side of the wall when he was swimming, and he made the turn and he hit the side of the pool. And back in the day, they used to take a Bible and snap that ganglion, and he did that accidentally in the pool. And luckily, and for him, he did not need the surgery, and that was the end of it. And this is again going to showing you DNT means let the body kind of take care of itself, and sometimes less is more, and do no harm.
I think those are really important concepts. I think that there's always nuance, and I think that that part of it also, gets lost in a traditional conversation. And I'll give you an example of that. So I also provide gender affirming care to adult patients, and I see patients across the spectrum of what their needs might be. And so what I've also seen is that there are some young patients that really are crystal clear about what they need. And I think it's important to empower those patients too, because oftentimes we think that, the older you are, the more you know. And there certainly is a level of wisdom that comes with age. But I do think that there are individuals that know exactly who they are from a young age. And I think respecting that and increasing society's acceptance of that is also important, because I think when that happens, that is a truly beautiful thing. And I'll give you an example of that too. So I walked into my clinic last week and I was evaluating a patient, an adult patient, for gender affirming care. And across from the patient is sitting this big, burly guy, fluffy hair, ponytail, tattoos everywhere. And we all make first judgments about what someone might be. And my instant impression of this father, it ended up being the patient's father, was that he was this big, gruff, burly guy. And I was completely wrong. This father, regardless of, how big and burly he was the most soft, supportive individual that I've ever met as a father. And the relationship that that patient had with their father and how beautiful that was, that is what I would love to see from so many parents and their children, and who present with conditions that are complex in nature and do require multidisciplinary intervention. But at the end of the day, that big gruff father, who is truly a soft teddy bear, was willing to support his son in whatever that son thought was best for himself. And so I think that is also an important nuance to the conversation, in that sometimes not doing anything can be harmful. Sometimes doing something can be harmful. I took a class when I was in college on Russian literature. And in that class, they talk about how inaction is actually a form of action. And that concept has stuck with me so much, because we take care of such a diverse cadre of individuals. And while some patients may benefit from surgery, others may not. I'll give you another example. I do ear reconstruction on young children, and I was doing an ear reconstruction on a 16-year-old. And beautiful, beautiful girl. And I did her ear reconstruction. We used rib for her ear reconstruction, and we had done smaller revisions to the point where her ear did look really nice. And yet, when I saw her in clinic each time, her hair would be down, which, as a surgeon and as a woman, I know that she was probably conscious of what her ear looked like. So during that clinic visit, once I felt like I had done everything that I could do as a surgeon to get her the best result possible, we all know that ear reconstruction is a little bit limited in terms of, making it completely natural, like the other side. And so once I had done everything that I could from a surgical standpoint, we started talking about where her insecurities were coming from. And ultimately, we came to the conclusion that her ear was actually her superpower because that would be her way of showing a broader group of young girls that nothing is perfect, but at the same time, it's your level of confidence that is able to really set you apart. So we talked and talked and talked over multiple visits. And most recently, when I saw her a couple of weeks ago, she came in with her hair in a ponytail. And that was priceless for me because I think as a surgeon, you do everything you can, but seeing your patient walk in with that level of confidence, that's really what we're all here for. So just to say that, sometimes surgery works and then other times surgery has done its job and then it's time to work on what's on the inside too.
You share a lot of good information right there. One thing I have to mention, one of the best qualities or the best quality that I like in any person is that they're humble, approachable, and not arrogant, sorry to be blunt. And you allow for your patients and you talk to your patients and you make them feel comfortable. And this is where any potential patient looking for a surgeon should be able to talk to their surgeon, have that confidence. Because the moment I talked to you that first time, and I said, you know what, anything you say, I can trust you because you mean well. Because you're beyond all of this financial gain, you're beyond the popularity, you're beyond because you work too hard for this. And same thing, likewise, you have, you know, on earth, just so that people understand the reality of what a plastic surgeon is. In the United States, there are less than 8,000 board certified plastic surgeons for a population of almost 345 million people. Fair statement? Less than 8,000. And this is where the training, the level of commitment, and every day it's not that you see 10 patients, all 10 of them are different. And you have to think, be creative, you have to use your judgment, the latest information, technology, whatever it may be. And you're using that, you're approaching your patients, your patients feel comfortable talking to you. And this is extremely important, where you as a patient, that young or old, whoever it may be, you have to establish that bond with your surgeon. And I feel that you, just by talking to you right now, you allow for that. And this is what that young patient needs to understand, that they have utmost 100% confidence, trust that, no matter what happened, your surgeon did the best for you. Your doctor meant well. He had or she had no other interest. And see, when you tell me these stories and you're talking to the family members and you're approachable, you're humble, that allows for better patient care. And I will tell you, that makes the patient feel very comfortable because now they're going to share with you what is their inner thought. And so I find that as a young patient or old, whoever it is looking for a patient, you have to have that old-fashioned doctor-patient relationship we need to reestablish. In today's world and age, it is telemedicine, it is in and out. You're seeing a patient for 3-5 minutes and you're out. No, you have to. I like what you said. Go once, twice, 3 times, make it a big deal. Have your surgeon be vested so that you understand your patient. Now, what I'm going to do here is I'm going to ask the attendees if they have any questions for Dr. Ranganathan or myself, especially my guest. It's a honor to have you here to share your experience. There's a lot of good information that you have shared. I just want to go ahead and, when I do my dissection, and I have no other better person than you to tell me, but I'm glad you gave that example. So as I dissect the implant and the capsule off of the rib, which is where 90% of the implants are, right on top of the rib. So in my practice, I remove the fascia of the intercostal muscle, the periosteum, perichondrium, the fascia of the pectoralis minor, the fascia of the serratus, and then the inferior aspect of the pectoralis major. So that ensures for me the entire capsular is removed, so that if the implant is ruptured, There is no spillage of the silicone. If there is, God forbid, those 3 patients in the last 2 years that were CD30 positive, I did not have to go back and remove the residual capsule because I've already removed it, correct? And this is where many patients ask me, is it safe to remove the periosteum and the perichondrium as well? And look, you're mentioning here, you remove the rib from the patients to reconstruct the ear. And this is a very good aspect and a very important aspect of ear reconstruction. And I'll tell you, that is one of the toughest operations to do in plastic surgery.
Yeah, I definitely think it's one of those areas that we need more research. And I think, even as you're talking about breast implants, I'm not a breast implant surgeon, but I do think that there's so much research that can be done on those topics so that we are providing people with the best outcomes possible. I joke that my reputation is my gold, it's my diamond, it's really all I have. And I also joke that my job is my only conflict of interest because I don't get any money or support from social media. And I do that intentionally because, I love that people are able to make a living off of social media. I think that content creators do such an amazing job, and that is added value. As a physician, for me, I want people to trust my judgment. And that is so hard to do when someone has those conflicts of interest. And so that's why I've, really prioritized that part of myself in that, I really want there to be no question of me being there for the patient, just like it is for you. And so I think those are the things that people should look for when they're thinking about who to trust. Where is someone getting their money from? Where are their conflicts of interest? And think about that as you're figuring out who to believe and then what to discard.
No, this is a very important point. Nowadays, believe it or not, people have hired influencers, there are other celebrities, whatnot else, to promote them as a plastic surgeon. And now they're basically getting patient traffic. There are other many Facebook group owners, basically founders who have like 10, 15, 20, 70,000 members on their group. And now they're promoting another plastic surgeon because they got a financial kickback. And now the surgeon is basically funneling, quote, whatnot else, capitalizing and financially gaining from that, quote, celebrity status. And this is where, if you ask me, the ethics, the morality, the professionalism is certainly very much important, that we could do not, as physicians, cross that boundary. Because, if you ask me, this is after so much time and effort we have only one interest and one motivation, which is to help the patient and nothing else. And if you ask me, with all the time and effort and the nights being on call and you literally practically lived for 15 years, 20 years in the hospital, right? And in the books, it is not worth, and what you said, it's your reputation, and that speaks for itself. You're too educated to be basically selling yourself or soul to the devil, right? Which is the dollar. No, you're doing it for the patients, because you know what? At the end of the day, I can tell you could have gone into many other aspects of plastic surgery, but what you did is truly what is, with craniofacial surgery, taking care of kids, and a lot of reconstruction, what is true, genuine plastic surgery. You're helping a lot of people. Not only that 18-year-old, patient of yours, or that child with the ear reconstruction, you're helping their parents. More importantly, you're helping their family. And for the rest of their life, they will be indebted to you for how you basically allowed for them to go out and celebrate their freedom and their faces, right? Literally for the rest of their lives. And that's a lot of power to have in your hands. And you have earned it. It is very hard to study for the MCAT, to study for the board exam, for the plastic surgery boards. And we're blessed to have our colleagues who have taught us what we know from these amazing institutions. And we continue to learn from our patients. One thing I want to mention, and then we'll take questions. What you mentioned is so important, and it is a very important point that you mentioned. You have to listen to your patient. What do they want? You have to honor them. You have to respect their wishes. We are no one to judge them. They come in with a problem, and you said very well, I listen to what they want. What are the goals? What are the implications? You might not necessarily agree with them, but you will give them what they want because it's what makes them happy. And that is, again, going back to why we became doctors and surgeons to begin with, and we continue to work every day. and night, I should say. Now, do we have any questions from any of the members?
I see some of my mentees and childhood friends here, so thank you guys for joining.
Yeah. So no, it's believe it or not, I have been given the task as a host to go in and look, and my daughter was trying to help me navigate this Zoom page, and I'll tell you, this is my first time I've ever doing this, by the way. So I am not computer savvy at all, and we thank Carla and AV here who are here assisting. So let me see if I can um, see anything you want to mention, Dr. Ranganathan, anything to anyone who might be interested. Let me see if I can go into that page and see if there's any questions anyone may have. What made you get interested in craniofacial plastic surgery?
So I actually wanted to be a pediatrician my whole life, and I was pretty set on that. That's why I joined the honors program in medical education when I was at Northwestern. But when I was in medical school, I was going to India. We used to go to India every year when I was growing up. And my grandmother was actually lighting a lamp in the prayer room, and her clothes caught on fire. And so I took care of her when I was there for 10 days, and she unfortunately passed away after that. But that was kind of the experience where I started thinking that plastic surgery might be my calling. And then my uncle in India was a pediatric plastic surgeon. And once I saw him do a cleft lip and palate repair, there was no going back after that. So that's how I became a craniofacial surgeon, and how I feel very fortunate to do what I do today. I think to some of my mentees on this call, one of the biggest um, one of the biggest parts of my job that I feel so grateful for is actually my mentees and the ability to contribute to the next generation of plastic surgeons. Because as I talk to them about body image and how you should present yourself and how you should talk to your patients, I think that that makes me feel grateful for the impact that I can have beyond myself and beyond, even my immediate situation. And so I'm really grateful for my mentees and all of those that I get to impact as a result of my job.
Right. No, I will tell you, the having worked in the many as a general surgeon and as a burn surgeon and a plastic reconstructive, we've taken care of a lot of dog bites, car accidents, cancers, big flaps, amongst the many others. And I will say that the sickest patients in the entire hospital are in the burn unit, in the burn intensive care unit. And I remember I spent 2 years of my life in the burn unit in Connecticut. And this is where I learned a lot, the between the inhalational injury, between the young kid that had a cigarette burn from the stepfather to, amongst the many other burns that we have managed. And truly, if you can manage a burn patient, there are so many implications that we have. What you mentioned is something also, I will say, and extend to the many young and old and whoever it may be. We're privileged and blessed to have a nice educational system. There are so many aspects of plastic surgery that we can offer, back home, in other parts of the world. Let me give you some examples. I took care of a 16-year-old girl, or I talked to a patient who at age 16 got breast implants as a birthday gift from her mom and dad in Mexico, and I thought that how wrong of a wrong could that be? And she basically was flat chested, and this is where her mom and dad thought that they would be offering a lot of good to this young, nice lady. And so she ended up having complications from her breast implants. Another, big aspect of, what you mentioned, burns. There are so many burns that occur in so many other parts of the world. There are patients that basically have a contracture of the finger, for example, and rather than doing a Z-plasty and releasing the contracture, unfortunately, they end up getting amputations of the finger because they do not know how to do the plastic surgery procedures. And unfortunately, there's a lot of, and I must mention, this is again part of the world that we live in, violent crime back home in like India, Pakistan, where, there's acid burns on the face of young women who basically they, were a part of domestic violence. And so there is so much to do There's so much awareness and help that we can do so that we can make this world a better place. And, like you said, from the day one old to 100 years of age, my oldest patient that I've operated on is an 89-year-old, excuse me, 92-year-old patient. And so we're blessed to see in plastic surgery patients from literally all aspects of life. Yeah. So,
Yeah, there's so much work we do as plastic surgeons. And I do think that we are front and center when it comes to seeing what is going on in the world from a social standpoint. For example, now I think there's such a huge level of gender-based violence. We're seeing that everywhere. And I'm so glad there's so much attention going to it because we've been seeing it for years. And the fact is it's gotten worse and worse to such a degree that that's why everything has bubbled up. And so I think that as plastic surgeons, those are the types of things that we see in our clinic all the time. And the fact that these issues are getting more attention just really speaks to how large the problem is. And I think
Can you
that as
give can you give some examples? Like what do you mean? Like if you can help clarify.
yeah, so my clinic is a clear representation of the social fabric of this country. In my clinic, every week, I see a patient with food insecurity, a patient that's not able to afford food. I see a patient that has been a victim of domestic violence. I see that very regularly. I see patients with unaffordable medical bills almost every single clinic. I see insurance denials all the time. There are so many parts of the world that we see in a plastic surgery clinic. Oftentimes what you think of in plastic surgery is someone like Dr. 90210 or, botched and the celebrity status of what it could mean to be a plastic surgeon. And so I think sometimes plastic surgery doesn't get the reputation that it truly deserves in that we are really on the ground feeling the impact of whatever our government is doing or whatever the people need at a ground level. And so that's what I love most about my job is that I get to experience with regular people, with everyday people, what is actually happening because of the work that we do.
Right. No, what you said again, a very important point. The number one reason for bankruptcy in the United States are medical bills. And this is where if you look at someone believe it or not, had a finger amputation. They wanted to go to the hospital, but their deductible was 15, and they said they would rather opt not for a reconstruction, but completion amputation, unfortunately, because it was a cheaper surgery. There are so many patients who go now medical tourism elsewhere to Mexico to get their $12,000 upper lower all the mommy makeover abdominoplasty, and now they have problems coming back, what I call, that the poor medical tourism effect, because people want to basically get cheaper surgery, but they run into a lot of problems, right? Now, there are some aspects of medical tourism that really work well. Like, if you want to get a hair transplant, Turkey is the way to go, without a doubt. And I would highly recommend it. But do not go down to Mexico or any of these other countries where you will get a 12-hour surgery and then run into problems, because as you come back, you have to deal with these issues. Now, there are important aspects. You have to stage the operation. That is, even if you want it, and you do not want to be, quote, be gullible enough to take an offer because it is too good to pass. Meaning, you have to do genuinely seek out a surgeon, not necessarily go out of town because it's cheaper. You want to do your homework. Remember, use your mind and your heart. And I always tell patients, for example, when I do talk to them myself, and I'm very much heavily involved in my clinic, and I love talking to my patients. I tell them two minds are better than one, three are better than two. And this is round one of the consultation. We're going to do round two and round three if needed. Let it sink in. Know exactly what you're signing up for. I tell my patients, get up at 2 in the morning, ask your heart and mind and soul if this is what you want to do, and you will know from your heart that this is the right answer.
Yeah, I think trusting your surgeon and knowing everything about what their expertise is so important. What we see in our institution almost every single week is what we've labeled as DR to ER. And what that is patients get surgery in other parts of the world. There are direct flights to a variety of different places from Boston, but we call it DR to ER because once you get surgery somewhere else, you come to us when you have the complication. And things like fat necrosis, mycobacterial infections, all of those are so common. And you want to make sure that you are not compromising the rest of your life for one surgical operation. And so, if surgery feels right for you, if you've done your homework, you can certainly get a good result. Just make sure that you are doing that homework in advance because it's so easy to be duped. You know, one of my close members of my family was thinking about plastic surgery and showed me their potential surgeon's Instagram. And she said, "What do you think of this plastic surgeon?" And I looked at their training. They were not a plastic surgeon.
Right.
And they were doing an operation that I would argue requires a very high level of training within plastic surgery. And until I told them, and this was a very educated person, they had no idea that what those images were not truly representative of what probably would have happened. And so that's an example of, don't be fooled. Don't just take someone's Instagram for face value. Really do your research. Where did they train? What level of training did they achieve? What are their outcomes? And I think that part of it is so important because you don't want to end up in someone else's ER with a complication. You want to have a good result.
Very, very, very important point, Dr. Ranganathan. Now, can you tell us what is the right or the proper or the optimal training that you're looking for in a plastic surgeon?
Well, I do think that there are a variety of specialties that are potentially able to do a good job. What we talk about in our field is that seeing a board certified plastic surgeon is really what you should strive to be able to access. That's certainly what I would want for myself if I was getting plastic surgery. I would want to see a board certified plastic surgeon. I think for injectables, Botox, that kind of thing, you have a little bit more flexibility, but even fillers have a huge potential for complications that are irreversible. And so, even for those kinds of things, I would certainly go to someone I trust, get a recommendation from a friend. That is more meaningful to me than photographs sometimes of what I see on different platforms. And so, I would say do your homework, but I think a basic expectation is to seek out a board certified plastic surgeon.
Right. Now, there are a lot of other boards of plastic surgery, and this is another important point that you brought up. I'm glad you did that. There's so many boards. Now, I could make up a board right now, American Board of Aesthetic and Cosmetic Surgery, and Carla, if you pay me a fee, I'll make you a member, and this is unfortunately what's happening, unfortunately. And this is, so right here in town, believe it or not, I'm not exaggerating. And this is, the Michigan and Boston. If you ask me, the center of excellence of the world is Boston when it comes to the hospitals, like literally, truly outstanding place. But right here in Michigan, which is like the 10th most populous state here in the US, with a lot of high concentration of a lot of doctors between Henry Ford, Corewell Health, DMC, Detroit Medical Center, you got University of Michigan, the top of the world. You have surgeons right here, general surgeons who are doing liposuction and breast augmentation, ENT surgeons doing augmentation, ER doctors, emergency room doctors doing augmentation and liposuction, under local patients getting gynecomastia surgery. And there's a GI doctor, for God's sake, gastroenterologist doing liposuction, because at least that's her area, right? Now, the point here is there is no regulation by the board, by the Michigan health legislature. These surgeries should not, it's like me trying to do a urological procedure or me trying to do OBGYN. This should be completely banned if you ask me. And I'm just surprised in the United States of America, you would allow an ENT surgeon to put in implants, breast implants. This is what I call a bent surgeon, BENT, breast, ear, nose, throat. That's like my way of he's a bent surgeon, and he's literally like less than a mile away from me, and he's probably done the top 10 augmentations here in Michigan over the last 2.5 decades. Now, the bottom line here is this: you have to do your homework, and you have to seek out someone who is ASPS board certified, the real deal, by the American Board of Plastic Surgery, not a cosmetic surgeon, because remember, that's a different spin, that's a different training, that's a different mindset, with all due respect to them. This is where uh, I will tell you, I know someone who is a PhD, a doctor, is an engineer, and because they liked an Instagram page and that doc has 10,000 followers, they sought out this dermatologist. And when they came back, they said that they were the least impressed. And I said, you were, sorry to be blunt, suckered into that Instagram. You did not do your homework. And when I told them, this is the person, because remember, in the United States, with all due respect, medicine is a business. Health insurance is a total absolute disaster. And you have to go to someone who basically says outright, my only interest and my only commitment is to the patient and no one else. And if I make money on the side, so be it. So in my, for example, level, one of my very close friends, I go to California and operate as well. So 2 weeks ago, I was in California. I did a total of 6 cases, and these were 2 explants each day. He said to me, what a waste. You could have done 6 augmentations in a day and had golf on Sunday. Monday, you could have done this. And remember, this is the whole financial aspect of the world we live in. And the point here, very humbly, I'm saying is, I told him, I have to say each one of my operations was almost 4 hours plus minus. And I feel genuinely indebted to my patients for entrusting me with their health. Yes, I flew out. It was a lot of work, but you know what? Each one of my patients is so grateful. And that respect that you mentioned, that you earn, that is priceless. That's what drives you. And I know that because I saw that when you posted that one post, and I can tell what you're about, and that you have only one interest is to help the patient. And all that hard work and effort, that CV that you mentioned at the very beginning, it's all about building up on it. And when you put your head on the pillow, you bet you are tired, but you're happy, and you're richer than any of these other docs who are trying to do harm and trying to capitalize on these young, innocent patients and old, whoever it may be. Because you remember, you have a lot of power in your hand, Dr. Ranganathan. You have a lot of influence. You have a lot of ability to touch lives. And this is where you say, you know what, I'm beyond that. I'm going to be honorable and I'm going to do what is good and right, so that when you get done, your legacy is going to be cherished for generations, because you help these nice patients who are looking for answers and who are hurting.
I'll be the first to admit that our healthcare system is broken. That is for sure. And I think that's why we need to participate. We need to become politically active. We need to stand up for what our patients deserve. We need to stand up for what it means to provide true healthcare. I think when you think about healthcare as it is now, it's really sick care. And there is a profit motive behind what it means to take care of sick patients. And that's the other thing that really motivates me, is figuring out a way to solve those types of problems. Because so far, what we've done is really band-aid solutions. And if we can really dig deep and figure out a better set of solutions, I think that will serve generations and generations of patients moving forward.
Now, hopefully, this all started with the Clintons in the early 90s, and then the Obamacare, which was, if you ask me, a complete, absolute disaster. Now, I'm not a politician, but I will tell you, if someone's sick, they should go to the doc and get genuine care. And when they come back, they know that they got the best care, the old-fashioned way, so that there was only one interest. I will mention, I have only one financial disclosure, and that is to the patient and to God, and that's it. I have no other financial incentive. And like you do too, you've worked so hard. You could have done so many other aspects of plastic surgery, right? But you choose to go and do these very tough operations. You sweat them out. It's not easy to harvest a rib from a child and reconstruct the ear. I remember my mentors would do that. Dr. 𝐬𝐮𝐬𝐫𝐞, the king of craniofacial. I must mention, Dr. Baiman Gairan, he was my mentor. I spent so much time with him. This doc is who I am. And Dr. Persing from Yale, Dr. Steve Arian from Yale, and all these other world-class textbook writers of plastic surgeons who have done a lot of good. And I'm sure you at Northwestern and also at Hopkins and all these elite institutions that you've been to, you've learned and benefited from so many of your colleagues and mentors who continue to guide us, you and I, so that we make this world a better place. I will let you finish, Dr. Ranganathan. It was an absolute pleasure to have you. I'm sure you basically you started a lot of you made a lot of very good points and gave a lot of good examples. And this is honest to God, I'm blessed and privileged to be a physician, to be a doctor, and to be able to change a lot of patients' lives. And this is the hard work that you and I have done, and we continue to do on a daily basis. And it's a privilege to have talked to you and to basically discuss these very important points.
Thank you so much for the opportunity to be here with you all. It was such an honor and I had a great time. Thank you.
No, you're welcome. Thank you very much.
Dr. Khan, maybe
Yes,
before we end, we have one question
yes,
that
please.
that needs to be answered from Pam. She said, "What if the implants are over the muscle? Is it easier for you and the patient when you do the end block removal?"
Right.
Maybe we
So
can answer that
basically,
quickly.
yeah. So when the implant is above the muscle sitting on top of the pectoralis major, there is no rib to harvest, to remove, to basically dissect on top of. So I removed the fascia of the pectoralis major, and it is, relatively speaking, an easier operation. By the way, both of my patients today were above the muscle. And so I had a very easy day. I got done early, and I was blessed to have two consecutive patients that were above the muscle. And so it is a relatively speaking easier operation. Now, having said this, there is no such thing as easy surgery. It is still involved. It is there is a lot of potential for quote problems that can occur, but I'm blessed to say that the dissection above the muscle is definitely relatively easier and relatively more straightforward because I'm not dissecting right on top of the rib. Now, if I may just mention that one patient, my second patient, she had MS and she had a lot of autoimmune problems. She sought me out. She has no medical background, the nicest patient from Indiana. She and her husband were so vested. They saw my YouTube videos, my lectures that I have done, and they knew exactly what my mindset was about. They understood exactly how I do the operations, what are the post-op expectations. Remember, the best post-operative care is the best pre-op and intraoperative, and so the best pre-op care is what leads to the best intra-op and post-op care. And this is where you have an informed consent. The patient was excited about the surgery. She was certainly nervous. And I can only imagine this nice 40-year-old lady who had the joint pain, neck, back pain issues, and other myalgias. That she will benefit from her explantation. It was an end block that I did. Blood loss was literally 3 cc's on each side. And she had what were above the muscle. So this was certainly easier, but it had very bad ptosis because there's nothing holding the implant. So they gravitate down with time. So I was able to basically balance the two right and left out. I will mention that any good, reputable, board certified plastic surgeon will put the implants below the muscle. So whenever I hear someone has put it above, I question who did it and if it was even done above. Now you see a lot of young patients in California doing their Preservé and the new set of implants above. You will see a higher rate of problems such as capsular contracture, infection, migration, displacement, among the many other issues with the nanotextured implant, which is the Motiva. You will see that this is not an ideal location to be putting above. It should be only put below. And I'll correct myself, any good, reputable, board certified plastic surgeon would not be putting in implants. Let's put it like that. All right. I will end with this. Thank you very much. Dr. Ranganathan, I will say we will bring you on hopefully in another 6 months. We will build up on this so that we can continue to engage our audience. And if they have any questions, we will be able to answer them in the best manner possible.
That sounds great. Thank you all so much. I really appreciate it.
You're welcome. Thank you. Thank you very much.
Bye.
Bye-bye.